You can put my slides, please. This presentation is going to be, even though the name of this conference is Transformative Endovascular, I thought that it would be a good reminder to, for the surgeons in the room that scalpel is a device that we heard earlier and that we should use it sometimes. My presentation on the front. So this is my patient. He's a 38-year-old man who makes a living. It's right there. It's on the screen. He's a 38-year-old man who makes a living out of doing triathlons. For those of you who don't know what a triathlon is, it's basically a race of 140.6 miles. And that is divided by 2.5 miles swimming, followed by 112 miles on a bike, ending with a marathon. He's not only a professional triathlete, but he's very accomplished in what he does. He actually lives here in Phoenix. Just to have an idea, 3-4 years ago in Coeur d'Alene, a beautiful course, he finished third overall with an hour of 8 hours and 33 minutes. This happens to be my passion as I work. I consider myself pretty fit. My time was 12 hours, so he beat me by 4 hours. And just to give you a sort of an idea of who he is. This is him, and he came to my office back in December of 2022. So this is a story. Just to show you more of his accomplishments, he made it to the 2023 Arabipa Racing team member. He's a runner for a famous club here in Phoenix. And you can see right there on the right side, first place 2017, first place 2022, first place, second place, first place, second place. This is a guy who's used to have these finishes. And this is what precipitated his visit. He decided, he was training for Ironman Wisconsin, and he decided to go to Colorado, 12,000 feet high baseline, to do what's called a double-triple bypass. That is 220 miles that you have to ride in 2 days. You climb 20,000 feet. And that wasn't enough. As soon as he finished the bike ride, he decided to drive to the Grand Canyon and run 26 miles inside the Grand Canyon, edge to edge. At that point, his leg became completely numb and insensate. And he figured, I'm training a little too much, and I'm going to just back off. So while he's used to run the Grand Canyon, he started walking it and finish. The next day, he continued to train. His symptoms were bad and bad, enough that a month after, he decided to go to a physical therapist and a massage therapist. These are just notes for interest in time. He finally got to see Venki, interestingly, here in Phoenix, who ordered an MRI and showed this. You can see on the right side, there's a complete occlusion. For those of us who have read or seen these patients, it's rare to have an occlusion. Usually you have a bending of the knee and a flexion of the iliac artery, but not a full occlusion. So let me show you the CAT scan. I'm sorry this is just taking my iPhone, but you can focus on the right common iliac. That's going to divide into the internal iliac soon, right there, and then the external goes completely away, and it reconstitutes at the groin right above the femoral head. And so Venki offered him a bypass, and unfortunately, this is a reputation I never intended to have, but 2 prior patients of mine, those are the Instagram, they came to me referred by a friend of mine, runner, who said, this guy in Tucson runs and does these cases. So he came to see me instead. And so basically back in January of 2023, I did his operation, which basically involves a exposure of the iliac artery open. This is a patient you don't want to take to the OBL for atherectomy or balloons or DCBs. There is no endovascular ways to fix this, or shouldn't be. So we opened the artery up and down, as you can see, and there was quite a bit of a chronic and also acute component. I think a lot of surgeons would have considered 2 incisions, one in the iliac fossa and one in the groin, to get rid of the entire material, but I decided to just try to keep it from above and remove the more plaque I can from above. And so that required the use of a Fogarty catheter, as you can see, and those are the pieces of plaque that were removed. Please keep attention on the day, January 30th, okay? January 30th, February 1st, I did a CAT scan that you can see head to head. The right side is post-op. So once again, the left you have seen already. The right side, you can see now the external iliac plump because of a patch and goes all the way. And so this is him.
So just came out of Pima Heart and Vascular here in Tucson. We just did an ultrasound just to see if the arteries is working properly. Everything looks very good. So now I just need...
I'm really bummed out that video is not complete. What he said was, now I just need to get back to my business, and please don't tell my surgeon that I'm gonna go back and run a marathon next week. I told him to actually take it easy for 6 weeks and begin swimming 6 weeks after. I told you to pay attention on the day. Day of surgery was January 30. This is 32 days after. March 2nd, he ran a marathon in Boston at 6:10 minutes per mile. For those runners in the room, I think a pretty decent runner is a 9-minute mile. So kudos to those prolines because they held a 6:10 minute mile. This is March, so this is basically a month post-op, and he's a friend of mine. We have done some races together. This just happened 2 months ago. As a 40-year-old man, now he's gonna come here in yellow. He just ran a 2:33 marathon. If you guys know, this is a 5:50 minute mile average. I think most of us in the room, including myself, will not run a 5:51 mile, let alone holding it for a couple and a half hours. So he is doing well. This is a disease that is not most known by most people. This is a board question for us vascular surgeons. It was described in 1985. It's non-atherosclerotic. This is a review that a nurse practitioner friend of mine who actually happened to have the disease, her and I and a few others did. You can see that in 1985 was described mainly males, but in this Me Too era with more women doing these extreme sports, we can start seeing a climb in females as well. These are crazy, crazy people. I mean, the number of miles or kilometers that you have to have in life to have this disease is extreme. It's like riding 100 or 200 miles since the moment you're born. This is basically males over females, mostly affecting, equally affecting both sides, seen mostly in cyclists, but now seen in other sports. So the challenge of these patients are they're young, they want to go back to their competitive levels, and so the stakes, I feel, are a bit higher with this pathology. Again, thank you so much for your attention.